So the next session is a bit more of a presentation type session. So the first was, obviously you could tell, was a sort of a Q&A on the experience at Stanford IT shared services and a bit of questions, take some questions. This is more of a presentation. However, happy to take questions as we go, or you can save them until the end. And it's more about some of the trends and best practices in higher education for shared services, specifically in operational efficiencies in general. So I'm joined by Chaz, who'll introduce himself in a second. But if you can go to the next slide, Chaz. Okay, so this is what we're talking about. I've touched on the profile a little bit, but I want to focus a little bit more on who we've worked with in the higher education sector, because you get some of the relevance. Then we're going to talk about why shared services. We touched on that a little bit with the SAM discussion, and I'm going to build on some of those topics and areas we talked about and see where we go with there. Then what's been going on in shared services, that's the trends part. Then Chaz will take over and talk about some specific case studies in higher education. And he'll talk through those as some cases of what's going on in higher education. I get asked that, this shared services thing, is it happening in higher education? Who's doing it? Who's not doing it? Is it happening across systems, or is it at the campus level? Is it at the locus level? Is it multifunctional? So we're going to talk about some real case studies, and Chaz will talk about that. And if we have any time left, we've got some tactics and insights, or what I like to call tips and tricks, on what you might like to do with shared services, depending on how much time we have. So, okay. So just briefly, I've touched this, formed 10 years ago. We have operations across the globe, here in the US, in Canada. I spent a lot of time on aeroplanes. I'm one of those crazy global services people on United. You know those guys are front of the line people. I've just done a ridiculous amount of air miles. And that's because I spent a lot of time going to these various locations, Europe, Latin America, Far East, etc. So we travel all over. So our experience basically is multinational across both the private sector and the public sector. So we've seen this. I've been working in this space called shared services and business transformation in general, technology enablement for a long time. Somebody asked me earlier on, what's the potential scope of shared services? Getting back to that, it's definitely what we call the big four: finance, HR, IT, and procurement. But it's really anything in the support services. It could be facilities management, it could be legal services, it could be help desk, it can be student accommodation management, or it could be anything to do with a service supporting the core mission of the university. And the core mission of the university, generally speaking, is education, research, and often healthcare, right? Those are the three of the main. There are others, but they're often education, research, and healthcare. So anything that supports those functions, those core missions, potentially can be shared services. Potentially is an important word, because not all of it can be. So Chaz, you want to go to the next slide?
Sure, and I'll just introduce myself. So Chaz Moore, I'm the Managing Director for Chazey Partners on the West Coast. I bring 20 years experience, spent 15 in healthcare, and also some higher ed. But it's interesting how healthcare and higher ed are quite similar. In terms of higher ed, you have your faculty, and in healthcare, you have your doctors. And if you talk to the representatives of those units, that doesn't mean you talk to everyone, nor does it have any mandate to speak to everyone. So that collaboration, the consensus decision-making, they're unique and they're different, but a lot of similarities. So in terms of my experience, my CFO Health Authority, we were amalgamated 18 entities into one of several amalgamations going on where I was. And so that was interesting, because each of the 5 super entities had their own pathway. And the one that we had with 18 was actually the most successful, and later on we brought another health authority onto our system, and we brought Chazey Partners on at that part. So that's where I met Phil. And so that was a really good, client-focused, engaged. It wasn't just about centralization, and we'll talk a little bit about that. And then I really enjoyed that process and joined the dark side, became the accountant.
So actually, what Chaz is talking about here is what we call the difference. A lot of our people are practitioners by trade, right? I'm not a consultant by birth. We had a bit of an exchange with Sam on the KPMG and the consulting background there. By the way, a long time back, I worked for KPMG too. So yeah, it's practitioners, and Chaz is a good example of that. So he has practical experience as a CFO and head of an operation and in healthcare and amalgamating operations, and that's how we first came across each other. And for better for worse, he's been working with me for the last 4.5 years. Okay.
And I'm not global services. I'm 1K, so I'm still unhappy. But apparently, IRS wants to talk to him, an honorary U.S. citizen or something. I'm not sure what that's about, so we'll find out.
Okay, so I mentioned private sector, public sector. The important thing I want to point out here is some of the universities. So we've worked with the UCOP, UC Path. How many of you guys have heard of UC Path? Okay, so UC Path is actually the technology. You're replacing the payroll and HR and payroll systems down in Riverside. UC Path, I've been told, don't say UC Path is the center. It is not. UC Path is the technology. But anyway, that is an example, because I was asked by the lady from UC Irvine earlier on, what collaboration is going across all of the UC, the University of California system. UC Path is an example of that, where you're setting up a shared service center on a new technology to provide payroll and certain HR services across all of the UC system, right? I know it's been a challenge in certain areas, and I know it's been emotional and up and down, but they are going live with certain areas now. I know they had their first go live, and they've got some more go lives. UCLA, I think, is going live. And UC Merced shortly. Anyway, so that University of California, we actually helped with the business continuity plan for the Riverside UC Path Center. So we helped with that. We also have worked and are working with UC Davis. So we helped do a review of the UC Davis Shared Service Center 2 years ago, when it sort of went off the rails a bit. For those of you that know UC Davis Shared Service Center, that's where I coined the phrase design, build, and shove it in, actually. It was sort of what happened there a little bit. It's going really well now. For those of you that know Sarah Reed, who runs the Shared Service Center up there, it's an excellent story, really great. I would recommend you talk to Sarah about shared services at UC Davis. It's a really good story.
And we also have a webinar, because Sarah came to our event in Los Angeles, and we taped that, and so we had a really interesting interview. And what was powerful about it is she came in at the low point and helped build it up. So there's a lot of honesty and comes across. It was a very interesting interview.
We're currently working with UC Davis on an HR program, looking at their HR operations. Iowa, so we worked with the border regents in Iowa, looking at their 3 state universities, which are down here on the left, the University of Northern Iowa, Iowa State University, and University of Iowa. Great example of one state, one university system, massively different cultures between 3 universities. But we were working there on finance, HR, and IT, so it was a big initiative, and helping them go forward with there. Lawrence Berkeley National Laboratory, just down the road, we helped them with their, for those of you to know, that Vera, the head of HR there, and Wade Crosson, HR Shared Services, worked with those guys 3 or 4 years ago. And et cetera. So it's a mixture of higher education, public sector work with the federal government, Department of Health and Human Services in DC, the government of New Brunswick up in Canada, et cetera, and then a bunch of private sector. So the experience is from a whole range of public and private sector, and a lot in higher education. But the conversation I heard earlier on, there is a huge, you guys know this, that's why you're here, right? There is a huge, massive, untapped opportunity in higher education to unlock, whatever you want to call this thing, unlock operational efficiencies. It's massive. Although I completely agree with Sam, efficiency and effectiveness go together. In fact, it's a great lead into one of the slides that's coming up. If you're efficient, you're far more likely to provide better service. And the other way around. It's not about cost cutting per se, right? It shouldn't be. It's about providing efficient and effective service. And they go hand in hand. So with that...
And just one to add on to that, we're working with a global science company, and they have their senior controller in Europe writing journal vouchers, and the senior global controller is approving them manually. Just kind of crazy. The actual controller is actually doing the journal entry. And we were reviewing and having a conversation, and it was a bit of an aha moment for them. Because the systems are not standardized, because their processes are not automated, everything's an exception. Everything is subjective. They need senior people making these decisions, doing basic processing, because nothing's been standardized. And so, in hand, Before you can say, well, yeah, we should have clerks doing it. We have to have lower paid people and doing it. Well, you can't do that until you do the standardization, until you get agreement from the client, this is going to be our service, and they're not going to be asking for different types of services. So that's the key bit, and we're going to talk about the critical success factor. You can't just do technology and expect that you're going to get success. You can't just do a reorganizational alignment and get the transactional work done by this group of people because they won't be empowered, because the client's still going to be demanding. So we'll talk more about that, but you need to, any structure can work if you throw enough people at it, enough money.
Okay. All right, so why shared services? We touched on this, we talked about it, Sam mentioned it. You can achieve the triple benefit of shared services if done correctly. So the triple, what does that mean? Higher quality services to the business, to the faculty, to your customers. And we could talk about who the customer is, great question again, but the customer, consumer, client, who pays, who receives service, that's a big topic. But you need to think about all of that. Who are they? You can provide higher quality to that group if you do this effectively at lower cost. By the way, if you can't do it at lower cost, then don't bother, right? I mean, if you're going to implement a process that costs more, then don't even go there, right? So you have to be thinking efficiency, and if you're not reducing the cost of service, don't bother. Do something else. Well, there's something else is up to you, but don't, because it's back to what Sam says, this is not easy, right? And I'll come back to that. And improve control. The control environment, visibility, standardization, use of same data, use of same master data, all this sort of stuff improves your control environment. Remember that piece of legislation called Sarbanes-Oxley for those finance guys in the room? I was the controller again, I was mentioned earlier on at 3Com when Sarbanes-Oxley came along, right? So people would, one of the things people would say to me, are we compliant, Phil? You know, this global organization across multiple jurisdictions all over the world. Are we compliant? Are we okay? Can we sign those things? Is that all right? It wasn't as simple as what I'm just about to say. I exaggerate to make a point. But basically, yes, we could, because we'd implemented a standardized global shared services type platform on standard ERP across the globe, across all finance, HR, IT was largely outsourced and insourced, procurement and manufacturing was pretty standardized. And so, yes, we could. And so the control environment was significantly enhanced as a result of what we did there. And it's the same in higher education. The thing in higher ed, though, of course, you start to bash up against this cultural thing called, you know, silos and control and ownership. And, you know, it's my school, stay out of it, it's none of your business, right? So there is that challenge, absolutely there. But it's part of the potential benefit.
And one comment, we'll talk about this a little bit in the tactics and insights. We'll talk about later about the importance of a business case. But what isn't uncommon is that there's an initiative, there's a driver to create shared services, and there's a key driver, a senior executive, and you just get on and do it. It's a no-brainer. And it ends up being a bit of whack-a-mole here. We need to save money. So that's what they focus on, and the quality goes down, or maybe the compliance isn't a focus, or maybe it's all about compliance, and so it tends to be red tape driven, and suddenly or maybe about quality, but now there's no money to invest in the system to get the quality. And so one thing that's really important about having that business case is you address all three, and you can't have one without the other, or it's whack-a-mole. You focus on one, and the other ones get worse.
Okay. So what is shared services? We touched on it with Sam. The important point here is define it. Define it. The definition can change from organization to organization, location to industry, but define it. So I've seen a lot of, it's what I call the CEO on the aeroplane. For those of you who've heard me speak before, it's really dangerous, right? At least it was in the old days before Wi-Fi. Because what happened was the CEO would sit on the aeroplane and nothing to do, right, to be twitching, and they'd read the magazine in front of them, and there'd be some article by some consultant that says, if you implement shared services, you can save 30% across your organization. They go, wow. So they go back to the head office and they say to the CFO or somebody or CIO and say, implement shared services and tell me when you're done. They've got no idea what it means, but somebody told them it will save them 30%. Very dangerous, right? So first of all, define it. What is it? So this is important. Shared services is not centralization in the old traditional sense of it. However, centralization, don't get me wrong, is part of it. Of course it is. You've got to get economies of scale and standardization, so it's part of it. But it's not the be-all and end-all, right? If you just centralize, You're going to alienate your customer back to the customer. So it's a lot more to it than that. So what is it about? Basically, if I'm in an elevator and somebody says to me, what's the fundamental difference between shared service and centralization? It's that. Shared services as a service delivery, back to, again, what Sam was saying, delivers services to its client, internal client, and it treats that internal client as if they were an external client. So if that external client's not happy, in theory, I say this as in theory, they can go somewhere else. In theory, it's important, because early on in this journey, if you allow them to go somewhere else, that could be mayhem, right? So you have to do it in a structure, but you're acting in that way. You're acting commercially. You're thinking about service. You're thinking about best practice. What is it that they need? Rather than what I call the traditional view of corporate centralization, which is, I know better than you. You cost too much. We're going to do it for you. This is what you're going to do. Take it or leave it. In fact, you can't leave it because I'm telling you have to. But what actually happens is they do leave it. They set up their own shadow organizations, their own side systems, their own processes. They say they're following your policies and procedures, and guess what happens? Your control environment is worse than it was before, not better. Your cost structure is worse than not better. So this is why this is so important, because it is ultimately about the client. Back to Peggy's question, who is your client? There are multiple different levels of client. There are your business unit leads, in the private sector. There are your schools and faculty and colleges. There's your administrative units. There's your consumer, your employee. So you think about, I'm not giving you the answer, I'm just saying think about them at different levels, and you start to think commercially. That's what shared services is about. It's not about, I work 9 to 5, if you want to have a problem sorted, I'm going on holiday for 2 weeks next week, you'll have to wait till I get back. If you were paying for that service, how long would you stick with that service? Wouldn't be long, right? So it's about thinking about that. So what are other things? I won't spend too long here, but it's about employing and using and training and leveraging a specialist team. So the shared services team is different. It's not the old school, but it might potentially be made up of some of the old school people who were around, have been reallocated, and I'm sure that's with Sam. I'm sure you didn't hire 40 or 50 people. I'm sure a lot of them are existing people. But you're a specialist team who are asked to do something differently, right? Geographically unconstrained. Does not have to be Janet or John sitting down the hall. When you take this to the extreme level, I'm not saying you want to do this in higher education, you can have some of the other side of the world providing services. Now, that gets into some of the negative connotations, right? Call centers. Call centers has a negative connotation about it, doesn't it? Oh God, it's the call center. When we were setting up the new shared service center for New Brunswick, in Canada, by the way, it's very cold in New Brunswick in the winter. Anyway, sorry, another story. So I used to get the taxi from the airport to the shared service center when I landed, right? The facility we used to set up the shared service center was an old call center. And so the taxi drivers would say to me, oh, you mean the call center? And I said, no, I don't mean the call center. I mean the internal services organization. So everything was about changing the way it was called. Because a call center has a negative connotation. Is the call center a part of it? Yeah, but don't call it a call center. Call it a central help desk. Call it something else. You see, part of it, and by the way, even if you call it that, it is about service. So if somebody, I'm going off, Chaz is going to say, stop going off on tangents in a second, Phil. But when you call that number, right, that's your first point of contact with a service organization. If that's a bad experience, what are you going to do? You're not going to call them again. You're going to complain. You're going to tell the 3 people in the coffee room So that first point of contact is really, really, really important. The point is, it's all about service. And again, Sam, you touched on it. It's all about service. So
I want to add one point around the definition. It's really good to spend a lot of time on it because shared services mean different things to different people. Right. And it's one thing you really do need to define. But if you ask yourself, pretend you're the CIO of your organization, and you've made a decision that you're going to reduce the hours of your help desk. Now, who are you accountable for that decision? Is it the CIO and he pats you on the back because you reduced your cost and you're doing a good job and you're still providing basic compliance service, is he happy? Or are you accountable to a focus group, your client, Are they really the ones who you're accountable to? And so what around shared services, it's not black and white. It's not a toggle switch. It's a spectrum. So how much is being shared in terms of governance, decision-making, designing solutions, real, true collaboration versus is centralization with some branding?
One other thing, we do have to move on, so it's my fault. The other thing is you sometimes hear the comment, is it a sweatshop? Is a shared service center a sweatshop? Is it a bunch of people who have been asked to do? Absolutely not. And one of the things about outsourcing, I'm not going to go into the outsourcing game because outsourcing has its benefits and its disadvantages, but one of the things that happened sort of 10 years ago was it became this out of sight, out of mind, right? It's not core, therefore it's not important. Absolutely not true. The provision of back office services is mission critical. You see those words there? Because I tell you, there's nothing that takes an organization down quicker than a failed back office. So it's mission critical, and make sure that people understand that and treat them that way and develop them and train. It's absolutely not a sweatshop or an opportunity. It's actually a real development opportunity for people in shared services. And the best performing and I've run some of them, best performing shared service organizations are empowering, vibrant, motivated staff who really enjoy what they're doing. If you do it wrongly, it can be a very negative, inward-facing organization. Okay. So I mentioned this. So when you get a decentralized organization, you get some benefits, right? It's very close to the business, operates in, provides local services. It's customized solutions, technology or process are very customized. It's not 80-20, it's 20-80 or something like that. But however, what are some of the problems? Well, you've got multiple standards, multiple different ways, high cost of doing things. It's not scalable for sure. It's very localized. And what about centralized? Well, some of the benefits are you can, in theory, have common systems of support, tight control environment, you get economies of scale, but then it's seen as remote, a bureaucracy, doesn't understand. You don't know what I want, you don't understand my business, you don't understand education, you don't understand research. You corporate guys have got no idea, right? That's the negative. So you've got benefits and challenges of both. So where shared services can come in if done properly is that you can actually achieve the benefits of both being centralized and decentralized, and you do it through this, what we call a client interaction framework, customer interaction framework, which includes very client-focused, commercially driven service partnership agreements as opposed to service level agreements. Service level agreements are blame tools, right? You said you were going to do this, you didn't, it's your fault. No, I didn't, yes you did. Did we write it down? Yeah, but I've never looked at that. That's a service level agreement. And in the outsourcing world, actually is a legal document, right? In a proper collaborative, you are in the same organization in shared service. You do work for the same institution. You should be working together for the better good of the campus and university, etc. And that's where partnership comes in. It's a long story, but there's a different way of doing things. And you've got clear costs and flexible delivery. So basically, you can achieve the best of both worlds by doing this. Okay, why shared services in higher education? You guys know this, but I'll just touch on a couple of things. Look, historically speaking, higher education and government, etc., hasn't had the drivers for funding that have been in place in private sector. That's just the way it is. That all changed, didn't it? 5 to 10 years ago, that all changed. I'm not saying efficiency was never an issue. Of course it was. But there are different drivers now. And what are some of those drivers? You've got growth, you've got funding and endowment, the recession, reduced. You can't keep raising tuition fees, right? You just can't keep doing it. You can't keep raising the GPA requirement and have out-of-state students to come in and pay. Did you hear about what the California state system agreed yesterday? They want a pay rise of 5%. They were given 2%. They say they're striking. I don't know if they are going to strike or not going to strike, but basically they're saying they can only afford a 2% pay rise, right? Money has to come from somewhere. So they're potentially going to be striking in April. It's not a limitless supply of funds. So we do talk to California. I've got 3 of my kids are in the California State University system. So it's a challenge. It's got to come from somewhere. There is a cost and a benefit to everything. So you know this. So there's a squeeze going on in higher education. There's a data point down here that we picked up that only 42% of chief business officers are confident their financial model will be stable over the next 10 years. It's a big deal, right? It's huge. And I'm not saying that shared service is some huge nirvana solution that's going to solve all ills. It's not. But it is potentially part of your solution mix at the university higher education at a campus and the research, and it's part of the solution. Why? And we'll come back to why it potentially is in a second. Okay.
And one of the drivers we didn't mention here, specific to the UC system, of course, is UC Path. UC Path, the technology, they'll drive up to the campus, and I'm just chatting with Dan over with HR. Right now there's, say, 20 HR systems. UC Path has no interest in integrating with 20 systems at Berkeley and 100 at UCLA. They're going to have one interface. So that's providing pressure for the campus to start saying, well, we need to have this one interface. We better do it now or they'll do it to us. And so trying to get ahead of that curve. So that's another driver when you use the term common enemy, a common driver, you need to get ahead of that.
Okay. I like this. I borrowed this from a presentation. I can't remember which presentation it was, but I think it was in Washington. Somebody showed this slide. I thought it was fantastic. Starts in 1978, for better for worse, 1978. The cost of the car has gone up by 93% between 1978 and 2018. This is scary. The cost of medical care has gone up 650%. You hear about that all the time, right? Especially here in the US. Cost of medical care. Look at higher education, college tuition and fees, 1,257%. And for those of you that pay for kids to go to college and involved in that, you know what that means. That is a staggering statistic, don't you think? The cost of college tuition and fees has gone up. Now again, I'm not saying that this is going to solve all evils, but it's part of the solution mix that can help you try and fund some of that. There's clearly a lot more to it, but it's part of the mix. Okay. All right, so what are some of the trends? And then I'll hand over to Chad. So what are some of the trends? I won't dwell on this too much, but it's been around for about 30 years, right? It was started in the private sector in the mid-1980s. I get asked this question. This is a cost question. I've talked about the triple benefit. How much can be saved from implementing shared services? That sweeping question you get asked all the time. The answer is it depends. But in terms of research and data in the private sector specifically, somewhere between 20 and 40% is a good metric. Can be a lot higher, can be lower. However, having said that, in higher education and public sector and government, it's been a little bit lower than that. Some of the data showing it's lower. And I think that's because higher education, public sector is learning, and it hasn't quite had the same drive and emphasis, and it's still going through the early stages. So some of the savings achieved to date are lower, but they are coming up. This data point I think very, very interesting. This is a Hackett for those of you, the benchmarking organization. They do this benchmarking. They have top quartile, best practice, lower quartile, medium organizations where top quartile is clearly the best. Best in efficiency, best in effectiveness, quality. This is a data point, 100% in their, not to 2013, I'll have to check the later ones, 100% of their top quartile enterprises leverage shared services to some degree. That is not 92%, that's not 55, that's every single one of them. Okay? There's got to be something in that. Now, I would always say be careful with that, because what does delivering shared services mean? Does it have it just in accounts payable, or is it prevalent across the whole organization? Is it just in payroll? But it's an interesting data point, right? So I like to share it. So it's about a driver. It's about improving services. If you don't improve services, it doesn't work. There are plenty of failed shared services implementations. You go to a conference, you go to Orlando, you won't hear about a lot of failed shared service implementations in the private sector. Why? Because why would you go and talk about a conference about failed shared services in the private sector? Your company probably won't allow you to anyway, but there isn't. I mean, I've done some sessions on failing shared service. I've written a couple of articles on it, and it's interesting. When you come in, I remember did one of these things. I asked people in the room, how many in the room thought that their failed shared services had not achieved its goals and failed? And loads of hands went up, which is why they were in the room. So it can fail, and it can fail if you implement it inappropriately, which is a big topic, and we'll come back to that. This multifunctional global business services model, traditionally old school, it started with, say, finance would go, or HR would go, or IT would do their own thing, right? So one of the bigger trends is multifunctional. Everybody goes together, usually because it's tops-down driven. Somebody at the organization said, let's go to that model, and it's definitely more prevalent in government and higher education, is that tops-down. We need shared services because we've got to drive some costs. Davis is a good example of that, for example. I'm not too sure, but are you multifunctional here at Berkeley? Yeah, so you're another example of that too. So that's in the old days, that wasn't always the case in the private sector. Technology. We touched on this earlier in our conversation. It's not all about technology. Technology, ServiceNow. I saw some smiles in the room when ServiceNow was mentioned. I've come across ServiceNow. I've seen it implemented very well. I've seen it implemented as a complete disaster. Again, because honestly, it's how you implement at the end of the day. I don't mean the technology. I mean the people side, the process side, the collaboration. One thing, a lady called Andrea Seymour, who worked at NBISA, GNB, Government of New Brunswick, too many acronyms, Government of New Brunswick. Andrea said to me once, there are 3 C's of change management, and I've used this ever since. You've got collaboration, consultation, and communication. Right? Communication is you send out an email to somebody on a Friday afternoon saying, this is happening, we're doing this, got any questions, give me a shout. Right? That's communication, very push. Consultation is within a framework. We are doing this. This is what's going to happen. We're moving to this new model. We want to consult with you on how best to achieve that. That's consultation. Collaboration, in the true meaning of the word, means you get together in a room, you collaborate, and you do not own the outcome. Right? The group comes up with the answer. Now, you can argue whether that's good in an environment like this or bad. What I would say is just understand what you're really trying to do. Are you really collaborating, or are you consulting, or are you communicating, or is it a mix of all 3? It's usually a mix of all 3, isn't it? But I would always say collaborate within a framework is a good way to do it. But don't collaborate to death. I remember at GMB, they'd been having collaboration meetings over and over and over again. And we were 9 months down in this, and we came and I said, stop collaborating. Do something. Because all you're doing is you're giving the ammunition to everybody that says you can't do anything. So have the collaboration, but if you don't do something, that was all a waste of time. In fact, you're setting up your own step for failure. So either have the... Another person said the other day, it was fantastic, they said there are three things involved with making a change. You need courage. Very important, because this thing's not easy. You need commitment, so you need to have the work ethic and get going, and you need patience. And it's the third element of that I really liked, because it's not just about shoving something in, or putting a new technology in, or telling somebody they're going to do it. You have to work with people. It's all about the process and the people. If you don't understand that, it won't work. So anyway, I'm going to have to move on from there. So basically, is higher education different? Yes. Is it different enough not to move forward? No. Right? There are some unique challenges in higher education. What you need to do is understand them. For example, failures. I talked about failures being not publicized. In higher ed, they are, right? As soon as something goes wrong, it's in the news, it's on the press, it's on some website, it's on some blog. They are publicized in higher education. It's different to private sector, so just recognize that. There is real campus politics, as opposed to just business politics. That happens. There's often a highly unionized environment. By the way, there are highly unionized environments in private sector. If you work with the workers' councils and unions in France and Italy and Germany, you've worked with some highly unionized organizations. So it's possible. I'm just saying, recognize that it's a highly unionized environment. You have to work with these agreements and these organizations. You've got different client groups. We've talked about that: faculty, health, research, schools, admin, etc. You've got this tradition and expectation of consensus, which touches on what I said before. Again, doesn't mean you don't respect that tradition, but don't let that hold you back either. Understand it, respect it, and then leverage it. And then we talked a little about the 80-20 and standardization, and the need to share funding. And it's all linked in there. And culture has a long history and longer memories. Yes, there's lots of tenure, people have been here a long time. So I'm not saying these are stopping you doing it. Recognize them. Many of these exist in other organizations, in the government, in private sector, certain private sector organizations. Some do, some don't. Just recognize and move forward.
Yeah, and it's interesting talking about failure, to jump ahead around case studies. University of Saskatchewan, they had a shared service initiative called Transform US, Transform Us. Great, cute little branding, great t-shirt. They went to an advisory council of the deans, and they explained what they were doing. Now, I don't know anything about the process, it's just right here. But one of those deans then, it was a confidential briefing, went public with it. And he said, well, I have tenure, I have academic freedom, I can speak to this. And he said, no, you can't. That's the dean. That's nothing to do with your academic freedom. And they fired him. And let's just say Transform US, because of how they handled it, stopped. And so they had one dissenting voice, and that one dissenting voice from a relatively small school actually became a national folk hero in Canada. And you guys may have heard about this initiative, but it was a highly publicized failure. It spoke nothing to the drivers that are still there, the good that could have come from it. So it's that culture and a consensus, you need to treat that with respect and really see that it's different.
Okay. So let's move on. So with that, Chaz, you want to talk through some case studies we've got?
I'm only going to highlight a couple.
Yeah.
So this deck is available, and I do want to hit some questions. I want to make sure we have some time for that. So just a couple. Pre-recession at many universities, many have followed. And what these case studies, what we've done here, we focused on non-California. Because you're hearing a lot about the UC system and what's being done, and CSU and the other universities at Stanford. So we wanted to bring some of the other perspectives in. University of North Carolina, this was interesting in that there were 10 areas, 200 projects. This was very much one decision you need to make is whether it's top-down or bottom-up. And we actually had an interesting webinar last week with Tom Andriola of the UC system in terms of UC Path being a major top-down project, yet that's not the only thing they're doing. They're collaborating with the UC system and all those in terms of bottom-up, and so they're using a bi-model approach. That's one thing you need to think about is that top-down, bottom-up, or a mix of the two. Yale University has been doing shared services for a long time. One thing that they really talk about is the provider-client relationship. I wanted to jump to Michigan. It's not on here. This was a big publicized failure.
Initially.
Yeah, Michigan, yes. I spoke like a Canadian.
Initially.
Yes. And I just wanted to get a couple of the things that happened here during the timeline. So administrative services kicked off in 2009. Communications under wrap until November 2013. So they kicked off in 2013, significant pushback, 1,000 faculty signed a petition. At that point, Michigan was ready to go live. And they basically announced we're doing this after 4 years in the back closets. So they paused the project, relaunched in 2014 with new leadership, new engagement strategy. So the big takeaway there is you really have to engage with people. So that's really key. I'm going to pause. I wanted to talk about that one because the failures are out there, whether you like it or not. What questions do you have? We have other slides on here, but I just want to pause here. Any questions on the definition of shared services, some of those trends, the models around centralization?
Yep.
Hi, I'm Michelle Bautista from Campus Shared Services IT here. And so you talked about siloization, funding and whatnot. That's my money, not your money. I can say what I want to do with it. And then you also talk about defining kind of cost effectiveness and efficiency and value. I always found that there's kind of this intrinsic conflict in trying to calculate the true value of and benefit of shared services because, say you're giving service to departments that never had service before, and that's never calculated in the end value. So what are your thoughts and recommendations on how do you capture true value of shared services and its effect and impact?
Okay, so that's a huge question, very good question. The answer is, it's a multi-pronged answer, but the answer is you try, right? So that's the first thing I'd say. The second thing is, well, how do you do that? Business case, which is why, business case is important. I mean, if I go back to GNB, Government of New Brunswick, when they first started, they did not have a proper business case. The clerk to executive council said, just get on with it, just do it. That's okay, but still do a business case, because within that, to get back to your question, you should be identifying what we call hard and soft benefits. The hard benefits are often cost or service level improvements, and the softer ones are we're going to provide services that weren't provided before. You can't value those softer benefits, but you should highlight them. And then you link them down the track to what actually happened. So if customer service improvements go up, you say, well, that's because we did this. The other thing about universities and campuses and schools and departments, some universities and campuses and schools and departments have services at that level today, and others don't, right? They just got away without it. They were too small, never had the money. So when you And they can be some of the great proponents as well, by the way. So if those departments are starting to get service they never got before, highlight it, write it down, put it in your business case, and then start to use those people to be proponents for what you're doing. When we've seen things go wrong, it happened a little bit in Davis to an extent, bring people together, and you have some people in the room who said it's terrible, and you have other people in the room say it's great. And you say to the people who say, could you explain to us why it's great in your experience? And you hear the people saying it's terrible in the same room, and they start to work out, was it really terrible, or is it, what's going on? So I'm sort of at a tangent, but really, you have to try, and it's about the business case. You have to monetize what you can, estimate other things, and then talk about narrative on the other, so write it down. And that's what you should do. And there's a real issue with that not being done. So many organizations, and not just public sector, private sector. And I mentioned lots of failures in this space, right? As well as successes in private sector. But one of the biggest errors made is lack of a business case. Because people say it used to be so much better, used to be so much cheaper. And they say, oh, how do you prove that? Well, we haven't got the data. So do it. The second challenge, though, I know this higher education thing, back to the common cost of service. How much does it really cost? My God, there's a difference between, I think it happens in government too, there's a huge difference between budgets and business cases, right? If it's in the budget, I can spend it, don't touch it. With business case, you're talking about ROI and savings, and so you have to the next point I would say, you have to make an attempt to reconcile your business case to your budget, otherwise nobody will believe you. So that's the other thing. Again, it's not easy. None of this stuff is easy, but it's not rocket science either. We're not building a NASA thing here. I mean, it really is about understanding requirements, looking at processes, bringing people together, seeing what technology you need, and then putting a plan together, engaging through the process.
And I'll just add a bit to this. The business case talk about those three critical. Talk about cost, that's pretty obvious by the name. But what's the impact on quality, client satisfaction, compliance? That all need to be part of it, technology. You also need to do your hard questions, your hard decisions need to be done at the business case phase when people are excited. Often when you have multiple schools, one of the schools will say more equal than the others, had more funding, been able to afford a higher level of service. You're going to go to the standard. So one of the questions you need to ask, can everyone afford that standard? Or are they going to come down a bit so that everyone can be equal? So often people said, you know what, let's deal with that in design. We're going to, or we're just going to amalgamate, and over time we'll get there. You have to deal with that up front. That decision's not going to get easier later. Do it up front when people are excited, when you're making decisions around technology. And then maybe say, you know what, yeah, we are going to be transparent. It's really a big part of it. We're going to come down in service, but it's for the better good. And this is what the standard is going to be going forward. That decision doesn't get, that conversation does not get easier. So the business case is the time to do it.
Okay.
Any other questions? We probably have time for one more question.
I'm going to, somebody mentioned technology as one comment. In the research we've done, other organizations have done, spend on technology is not the issue in higher education. Spend. The amount of dollars spent on, this shouldn't be a surprise, by the way. Spend is not the issue, it's use of spend. Right? So if you look at any metrics and benchmarks, if you have multiple silos with multiple different technologies, some old, some new, not integrated, not standardized, of course you're spending a lot of money on technology. So it's actually, and it's not easy again, but it's not that difficult. Over time, you need to start thinking about how you bring those together under this structure and use that money better. It's not, you're not having to go to your, the Board of Regents, for example, and say, I need another 20. We see this all the time. We get shared services, oh, we need another $50 million to implement SAP. Why? We already have SAP. Why do you want another $50 million to? Because we've been told that if we re-implement the ERP system, we're going to get all these bells and whistles and everything. Back to, again, Sam, I'm going to echo what he said earlier. No. Step back and say, what is it you really need? Try and leverage the technology you've already got. And then if you still need an ERP like UC Path, because some of your payroll systems and HR systems aren't great, so that's a different point. But leverage what you've already got first. And look for opportunities to leverage that spend. And then you won't be having to ask for a huge check, which will put everybody off doing anything. Okay?
Right. Thank you. So we're good on time.
A couple more. You want to just quickly walk through the other ones that you...
So state of Iowa, we talked about, this was an example of top-down with the region, but then leveraging the work of the various universities. This was interesting in terms of the number of shared service centers. That sometimes comes up. Are you going to have a shared services by function, by school, by academics versus staffing? There's a lot of this, those are some of the organizational model. Definitely world-class leading practice is to go to one shared service. And Sam talked about this in terms of the matrix conversation, and that's where you're going to get your efficiencies and standardization. But if one thinks it might be a step too far to go there right away, so maybe there's an interim transition way to do that. University of Oklahoma, this was interesting. This was about IT. Really key is cost efficiencies was one of their key drivers. It's always there. And you don't need to be scared about that. You don't necessarily start with cost efficiency. Start with the quality, start with the compliance, and say, by the way, it's going to be cheaper. That gets people quite excited about it. University of Florida, they had a major challenge with their primary customer to faculty. So you really need to have a strong engagement program. And the City of Houston was a really strong example. We did another, we had Omar at our Washington event, and we taped that event, and he talked about
I recommend
their experience.
you guys watch that if you can get the link from the Bloomberg guys. The link to that. I do an interview with Omar Reed from the City of Houston, excuse me, and what they did in HR. It is a fantastic story. And Sam, you mentioned going back to typewriters. You should listen to what he says about how City of Houston HR ran when he started there and what they did to basically bring it right up to date and much more efficient. It's a great story. You can watch that interview. And we actually also have a case study, a written case study on that, which we did with Omar. Mm-hmm. So if you'd like a copy of that, let one of us know and we'll send you that. Okay. We don't have time for tips and tricks. They're on there. We often don't get to the time to have tips and tricks, but they are on there. You will get all the decks, so please, if you take them and if you have any questions. We also have we've written a lot of research papers on this. We have one specifically on higher education. Again, if you'd like a copy of that, give us a shout. With that, I'm going to let Chaz take it from here. He's going to do the final interview. Thank you.